Hi, it's Dr. Hillary, and we are on day 4 of our supporting you after a loss or a miscarriage or a big trauma and ways to help keep your body as grounded and stable and in recovery. Today we're going to just talk about some nutrients and important supplements to use as you're supporting yourself through this process. One of the things that can happen if you've suffered a loss or a miscarriage is that there's a good amount of blood loss, okay, sometimes for some women. And what we really want to make sure is that you're keeping your iron storage and your blood robust. Blood deficiency is something that can happen. And in Chinese medicine, blood deficiency can contribute to just feeling fatigued, not very resourced. You can have vision issues, scanty periods, not feeling quite yourself. So we really want to make sure at this time, it's a time when you're going through a lot of emotional stress. It's hard to get to taking supplements. It's just one of those things that yesterday we spoke about eating, like the eating and the taking of things can become very challenging. So doing things like very nutritive bone broths and soups and cooked vegetables, easily absorbed foods is important, but staying on a prenatal is very, very important. So when you eat your meal, if you're eating your prenatal, taking your prenatal, that's a very important thing to do during this process. It gives you important B vitamins, your zinc gets supplemented, your iron stays supplemented, and that is something really important to do. Prenatals can obviously cause nausea if they're not taken with enough food. So what you can do is back off your dose. If you are taking a prenatal that requires 2 to 3 supplements a day, you can back it off a little bit if your body can't seem to tolerate that. But staying with some level of supplementation is really important. I also think that taking essential fats is incredibly important for your brain health and for the recovery of your body. So kind of taking higher doses of essential fatty acids, that's your EPA, DHA, your fish oils, is really important. Many women will have been on those things during their pregnancy, and maintaining it during the time of after your miscarriage or loss is very important for your brain health. As your hormones shift quite dramatically, it can really contribute to anxiety and depression, not to mention that you're going through the emotions of a loss. And so having the fish oils on board is very nutritive. You can think about it as just sort of like bathing your brain in good fatty acids. You want something absorbable. Foods like sardines, anchovies, salmon, those are very high in essential fatty acids. Those are just typically not things that we eat, and not things that we eat, especially if we're like in trauma. So it's hard to get everything you need. Chia seeds can be really helpful, but taking a good fish oil supplement and even doubling up on your fish oil supplement can be really supportive to you during this time. Many people will also experience sleep issues and sleep troubles, waking up in the night, 1 from the hormone changes and 2 from just the overall stress and trauma. Magnesium is one of the things that can be extremely supportive to help your sleep, to help your muscles relax, to help soothe your nerves and your nervous system. Magnesium comes in a lot of different ways. There's magnesium glycinate, which is very good for anxiety and for mental health. Magnesium citrate. These are things that are used often for working with constipation. But so getting a good magnesium is very helpful at night. Taking 2 capsules at night to help you sleep, somewhere between 200 and 400 milligrams is a good dose. The side effect of too much magnesium is diarrhea. So if it causes a loose stool, you can back it off. Another great way to get magnesium and to calm your nervous system is with an Epsom salt bath. And just using a lot of Epsom salts, that's using magnesium sulfate, like a magnesium that gets driven into your body as you're soaking in the tub. So if it's too hard to take oral supplements, magnesium through the bath can be very soothing to your nervous system, especially before bed. So those are the things. I don't want to make a big, huge list. Obviously, when we're working one-on-one with patients after a loss, we're doing a lot more sort of medical work or looking for nutrient deficiencies and trying to fill those. And that would be a great thing to do with your provider, especially at week 3 or week 5 after a miscarriage, getting a good sense of what's happening with your iron levels. Was there a blood loss? Is your zinc in good shape? How are your hormones? What's going on with your symptoms, and working with your nutrients and supplements that way. But really thinking about just maintaining your prenatal, doing a fish oil, staying on a probiotic. So at Cultivate Fertility, we've got a prenatal pack with a very highly absorbable prenatal vitamin and a fish oil and a probiotic and a vitamin D. They're all together. So sometimes just taking those packs can make it so that it's easy for you to get absorbable minerals and nutrients morning and PM packs, and you don't have to overthink it. Those are sort of the foundational 4 to help you keep your system going as you're moving through the trauma. But using also an additional magnesium can be really supportive. So I hope that serves and helps you. And please reach out if you have any questions. You can always reach out to hello@cultivatefertility.com if you need support after a loss. We would be happy to be of service to you in any way. Have a good day and take good care. Bye-bye.